name is Dr. Jason Emer. I'm a board-certified dermatologist here in Los Angeles. Well, years ago, I got hit in the face with a baseball and I broke my nose. And I had emergent surgery, and it was unbelievable how my nose from the accident to afterwards changed how my face looked. And ever since that time point, I always wanted to do something in aesthetics.
The whole concept of aesthetic medicine is about a transformation.
I've been in the room when acne scarring patients have cried because of the results that they have. I've been in the room when a lipo patient comes in, they had a horrible surgery before, Dr. Emer revises it, and their body is close to near perfect.
You're not gonna find another doctor who does the complex treatments like Dr. Emer does.
I love the fact that he's very innovative. He always has ideas. He's crazy. I like crazies.
If you started a church, I'd be in the front row, and I don't go to church.
My practice specializes in sort of transformational treatments. We do everything related to skin, face, and body. We do a mixture of body surgeries like liposuction and transformational skin removal, skin tightening, breast surgeries. We also do a lot of skincare and lasers specifically for acne scars, pigmentation, and wrinkles, anything related to anti-aging. I'm your guy, and my team is.
So Dr. Emer redid the tummy tuck. He did the lipo, the 360 lipo, so he took all the fat where you don't want to have fat.
Shawnee is a classic case of a woman who has had kids and then had a tummy tuck, and the tummy tuck just didn't look good. The scar was really high, a little bit of fat developed on top of the scar, so there's a little pouch kind of hanging over. Her belly button shifted to the side, so you have this beautiful, slender woman who now has a belly button that's off center. Obviously, she's not gonna wanna wear a bikini, she's not wanna do belly dancing, she's not gonna wanna do anything that a young, sexy girl would want to do.
There are a lot of doctors that should not be practicing. We get a lot of revision cases in terms of lasers and in terms of surgery.
One of the things that I do is helping patients in the down under area. What is that? That's the sensitive areas, the vagina, the penis, you know, the anal area, the areas that so many people think is taboo, they don't talk about a lot.
Just like women in their breasts, some want smaller, bigger, closer together, you know, whatever, softer, harder, I don't know, a different shape.
Is a patient of mine that wanted some just penile enhancement, male girth enlargement. When I was taking fat and injecting some of my HIV patients in the face, one time someone said to me, "Can you take a little bit of that fat and inject it into my penis?" And I thought, well, it's fat, it's natural, why not? And I did, and it sort of grew into this huge thing that I do in my practice, which is, you know, male enlargement.
One time I asked him, like, why don't you figure out how to help women grow? Like, hypothetically speaking, if they had one too many waxes and they wanted to regrow pubic hair, I'm like, why don't you figure that out? It would be a huge thing. I mean, the 70s are back. Hair grenades are back.
I can vividly remember when I was a resident and fellow in New York, you know, treating patients that had scars on their face after skin cancer surgery. One of them was a younger patient in his 20s, had come to the dermatologist to one of our clinics with a bump on his face that everyone thought was acne. We did a biopsy and it was a basal cell carcinoma. We did something called Mohs surgery, which is a type of surgery that specializes in removing just small amounts of the skin cancer to limit the scarring from that cancer removal. And in this case though, the cancer was really large. It had fingers underneath it that were spreading, and he was left with a dime-sized to quarter-sized hole on his face from something that was just pinpoint, and it was devastating. We had to reconstruct it with a large scar on his face, and I just remember, you know, a young 20-something-year-old having that type of scar on the face, having to explain, you know, how he got it, what it made him feel like to have that scar, everyone looking at him. Why can't we mature these scars earlier? Why can't we make people feel better more quickly? Why do they need to have that depression for that long period of time after having this scar on their face? So we did fractional laser at that time, and combined it with some peels, and within 3 months, the scar was completely invisible. It totally changed this person's life, and to me, that was the starting point of when myself and other dermatologists really started focusing on how do you heal the skin, how can you speed up a healing process, and how can you get rid of scars more quickly with the technologies that we have.
I've consistently been doing Botox and filler to my lips. Also, he adds a little to my cheeks and in my chin, and he goes for a heart-shaped look. And so, I kind of forgot about it until this gal mentioned it and was complimenting me about it. I was like, oh yeah, he has done that.
If you can make a connection between Miranda Priestley and Dr. Jason Emer, they are one and the same.
Everybody knows the parts of themselves that they don't like. And we're in a media-driven world. Everybody sees their selfie, and most people it's like, yuck. So to be able to fix the things we don't like about ourselves and understand that when we're in this public sphere, which often includes media, that our appearance represents the best part of what we want people to see, that's a confidence builder you can't measure.
It wasn't about learning and being the best dermatologist. I really wanted to be friends with my clients. I wanted to change their lives and whatever was their goal for themselves. And I started doing treatments that I knew would have an impact on their lives. Whether it's, getting more dates, whether it's just looking good in the clothing, whether it's for yourself. Some people just want this to feel better about themselves.